Hi, I am Professor Dylan Ritchie, and this is N310A, Fundys 1, Module 4, here at Aspen University. So let's jump in, and the content is going to focus actually on Chapter 15 in your textbook, which is Nursing Informatics. There is growing recognition of the importance of informatics in healthcare as a whole. Nursing represents a large percentage of the workforce in the United States healthcare, and it is a profession that is critical to the successful widespread adoption of healthcare information technology, or IT for short. If nursing can advocate, adopt, and integrate IT initiatives in practice, the positive impact will be felt beyond the practice of nursing. As the United States healthcare system considers reform, it is important that nurses are able to use the information and communication technologies that address issues such as quality, cost effectiveness, and outcomes of care. So let's talk about defining nursing informatics. So informatics is a broad academic field encompassing artificial intelligence, cognitive science, computer science, information science, and social science. Informatics tools in healthcare include computers, clinical guidelines, formal medical terminologies, and information and communication systems. Nursing informatics is a specialty area of informatics that addresses the use of health information systems to support nursing practice. As a nurse assesses a patient, data points are collected and organized as a source of information. The computerization of nursing practice data enables capture, storage, retrieval, organization, processing, and analysis of information. The information can be used to make a diagnosis, plan for care, provide nursing decision support, enhance documentation, and identify nursing care trends and costs. Systems that support data collection at the point of care directly enhance patient care by reducing the potential for errors and supporting improved assessment and data communication. Computers, tablets, or other pocket devices used at the bedside for documentation are examples of point of care technology. The American Nursing Association, ANA, states that the specialty of nursing informatics integrates nursing computer and information science for the management and communication of data, information, knowledge, and wisdom. Think of data. Data are the facts, observations, and measurements that can be used as a basis for reasoning, discussion, or calculation. But until they are organized and processed, data is meaningless. Information is organized and processed data that can be communicated and are meaningful and useful to the recipient. Knowledge is organized and processed information that can be applied to problem solving and decision making. The transformation of patient data to clinical information becomes nursing knowledge. Wisdom addresses the use of knowledge and experience to manage and solve problems. Wisdom is the appropriate application of knowledge. At the wisdom level, a nurse uses critical thinking to interpret and evaluate nursing knowledge. At each level of processing, some type of knowledge is produced. And I think in your textbook, figure 15.1 really puts a good visual aid to capture this progression. Summarizing the benefits of informatics. In healthcare, treatment decisions are based on information derived from data. If data are faulty or incomplete, the quality of the derived information may be poor and decisions may be inappropriate and possibly even harmful to the patient. Healthcare depends on information. Nursing is an intensive profession, and nurses must be able to work in data-rich environments. The actions nurses take depend on the information and knowledge available. The ability to quickly review laboratory results or review a complete medication profile can help the nurse choose appropriate interventions. Long before the development of computers and their widespread use in healthcare, Florence Nightingale became the first nursing informatics specialist. She thought that accurate data must be used for nursing decisions. She used data and statistics to address the healthcare issues encountered in the Crimean War. Use of healthcare IT has improved organization, communication, and decision making. It has reduced duplicate orders, charting time, and paperwork. It's made medication administration safer and enhanced information access and administrative functions. Current initiatives in healthcare IT are focused on admission systems that capture demographic patient data and bed availability. The electronic health record, which moves the traditional paper patient chart online. Computerized provider entry order, barcode medication administration, abbreviated as BCMA, and e-prescribing, telehealth, personal health records, and radio frequency identification. IT can be used to increase patient safety. Errors are analyzed to develop strategies for prevention. Diagnostic test results are available sooner to support treatment decisions and avoid redundancy in orders. When technology such as BCMA or barcode medication administration, when BCMA is used as part of the process of medication administration, fewer errors are made. After signing into the system or scanning the patient's his or her identification badge, the nurse electronically scans the barcodes of the patient ID, the electronic medication administration record, also known as EMAR, and the drug to ensure the right patient is getting the right drug and dose at the right time. An alert signals a potential error and gives the nurse responsibility to verify all administration before administration. Computerized Decision Support Systems, DSSs, sometimes called clinical decision support systems, include safe practice alerts and reminders that improve the quality of care. Some DSSs assist in determining a correct diagnosis and choosing an appropriate medication. Access to needed information at the point of care supports evidence-based practice initiatives. Computerized Provider Order Entry, or CPOE, allows providers to be directly entered, communicated to the appropriate department, such as diet orders going to dietary, medication orders going to pharmacy, lab orders breaking out to laboratory. Elimination of intermediary for order transcription decreases the potential risk for errors related to ambiguity of handwritten orders and allows quicker responses by the appropriate departments. Legibility and availability of computerized documentation improves provider-to-provider communication. The Agency of Healthcare Research and Quality recommends CPOE as one of the safe practices for better healthcare. CPOE systems ensure legible orders and have the potential to reduce ordering and transcribing errors. Disadvantages of CPOE include workflow issues, provider resistance to new technology, and overdependence on technology. A standardized nursing terminology is a structured vocabulary that provides a common means of communication among nurses. A standardized language ensures that when a nurse talks about a specific patient problem, another nurse fully understands that problem. An example is the choice among pressure injury, pressure ulcer, decubitus ulcer, and bed sore. Do all nurses in all settings have a shared understanding of these labels for a patient problem? Implementation of electronic records increases the necessity for standardized terminologies for documentation, because computers cannot make the association between different expressions meaning the same thing. The use of standardized terminologies promotes consistent documentation and allows the description and comparison of nursing care across a variety of settings, facilitating measurement of impact of nursing interventions on patient outcomes. Implementation of a standardized nursing terminology has made a significant impact on patient outcomes. McCormick described how standardized terminology in nursing can be achieved through comparable, shareable, quality data-based evidence. There are specific standardized nursing terminologies and multidisciplinary terminologies such as SNOMED CT, SNOMED CT, which is systematic nomenclature of medicine clinical terms that support nursing practice. SNOMED CT is a coding system, controlled vocabulary, classification system, and thesaurus designed to capture information about a patient's history, illnesses, treatment, and outcomes. The use of a standardized nursing terminology provides visibility to the nursing profession and documents the value of professional nursing. Key areas of possible ethical conflict related to IT in healthcare include the creation and retention of documentation, ownership of software, ownership and integrity of data, preservation of privacy and confidentiality, and prevention of computer fraud and misuse. Patients' rights must be protected. It is important that nurses know about the applicable laws and regulations, policies, procedures, an ethical code of employers, and the ethical code of their professional organizations. Data security and confidentiality of patient information are major issues. Access to electronic records requires a user to have system access and verification codes as a measure of security and the protection of the patient's privacy. The codes leave an electronic trail of authorized users that can be audited at any time. Only staff caring for the patient should have access to the patient's records. HIPAA of 1996 sets the standards of how security and confidentiality of healthcare information must be maintained. The Act also sets the penalties for any breach in security of healthcare data. According to a paper released by the National Council of State Boards of Nursing, social media and similar electronic communication use has dramatically increased among nurses for both personal and professional purposes. Although social media has many benefits, it can lead to HIPAA violations of privacy and confidentiality when too much information is shared about one's patients or coworkers. Be aware of policies that govern the use of electronic media in the workplace. For example, what websites may be visited during use of the employer's computer system. Refrain from making comments on social media networking sites that could lead to the identification of a specific individual. A nurse who engages in unprofessional conduct or breaches confidentiality may be sanctioned by the State Board of Nursing and risk any incurred sanctions, including permanent loss of one's nursing license. Guidelines that help avoid problems using social media include no transmission of any patient's image, no posting of any patient information at all, including names or other identifiers, no derogatory or disparaging comments about patients or staff, and no contact with patients outside of the work setting. Report any breaches immediately for quick resolution. The Computer Ethics Institute, CEI, was founded in 1985 to serve as a forum and resource for identifying, assessing, and responding to ethical issues associated with the advancement of information technologies, and to facilitate the recognitions of ethics in development and the use of computer technologies. CEI developed the 10 Commandments of Computer Ethics, which you can see in your textbook in box 15.3. So what is the future of nursing informatics, and what does that look like? If you have the desire to pursue a career that is computer-based, based on technologies and improving healthcare from a systematic and electronic performance standpoint, this is a question that may be something that you want to solve. What does the future look like? Discuss any examples of currently used technology in informatics and what the future may look like for nursing when discussing nursing informatics during Module 5 of Fundys 1. Thank you.